What are some strategies that people are considering to make CAR T cells last longer?
So this is the first generation of CAR T cells, or the first wave, I should say, of CAR T cells, because they're second and third generation CAR Ts in terms of their structures. The way that we're thinking about CARs now is to see if we can utilize two different targets to make the CARs more cancer specific, or that particular cancer specific. So those questions are being asked. The second way is to try to push cells towards the memory T cell phenotype, and this is by having equal amounts of CD4 and CD8 positive T cells. Then there is another strategy of spiking the culture in which the T cells are growing or being manufactured with certain inhibitors like PI3 kinase inhibitor to push cells towards that phenotype, and then exploring the possibility of using IMiDs or checkpoint inhibitors after patients have recovered from CAR T cells, CAR T cell therapy, to see if you can make these T cells live longer, and not just live longer. Does that actually help in sustaining the response? Because that's the eventual goal.
Would harvesting and storing healthy T cells and using them later make the CAR T cell product better?
That's an interesting concept. So the idea of storing your T cells just like one would store stem cells, I think what you're proposing is not an unreasonable thing. Logistically, you can imagine that it's a problem of where do you store these things and how many do you store and who's going to pay for the storage and how long are you going to keep them stored. But I could potentially, but it's clear that probably the earlier on in the course of disease that you take T cells, the healthier they are, and so theoretically they would be the better T cells to use if you could do that. So it's not an unreasonable concept. I just think from a practical perspective it may be a little bit more complicated to implement.